Hola. Hi.
I will be a Spanish interpreter.
This clinic in Park Heck serves one of the most diverse populations in the city. 1 out of 5 patients don't speak English or French, so they turn to this translation service to help patients and doctors communicate.
Did she get her vaccinations?
¿La vacunó?
Sí. Okay.
Does it change things for you?
Well, it makes things really much more effective. We have a very vulnerable population. We want to provide them with good medicine, and good medicine is based on communication. I am not a vet. I do not do veterinary care. I talk to my patients.
Welcome. Here. Okay, give me a minute. I'm just going to call the interpreter, okay?
The translation service, accessible through an app available on phones and tablets, was piloted at the CLSC 2 years ago.
We could give it to you today. It would be a good time for that.
हाँ जी, आपका बहुत-बहुत शुक्रिया आपने हमें बताया.
You've worked here for 5 years, you said. How often do you use this new system?
I would say maybe 1 patient out of 4.
Wow.
It completely changes my practice because I can have access to like super important information from my patients. It also gives them an open door to tell me whatever they're not able to tell anyone throughout the day.
The woman who launched the project says access to the best care was always the top consideration, and that language politics wasn't a concern.
There's a lot of literature that shows that if a patient cannot communicate effectively with their care team, this causes huge issues in quality of care. It also is a lot more costly for our system. They need a lot more tests, causes complications, causes patients also to not want to access care, so they end up in the emergency department in a lot worse state weeks later.
Something she says the health authority is trying to avoid, and why it is expanding the service to other clinics and the Jewish General Hospital.
Maximum, the upper limit should be 5.2, but sometimes